How does health insurance step therapy work? Imagine you're prescribed a medication for a health condition, but your insurance company has a plan to manage costs carefully. This is where step therapy comes into play. Step therapy is a process used by health insurance plans to make sure that the most cost-effective treatments are tried first before moving on to more expensive options. It's often called fail first because patients need to try lower-cost medications and see if they work or cause side effects before the insurer will cover a higher-cost drug. Typically, the process involves several steps or tiers. The first step usually includes generic or lower-cost drugs that are proven effective for many patients. If these medications do not work well or cause intolerable side effects, then the patient can move to the next step, which might include brand name or more expensive drugs. The specific medications and the number of steps vary depending on the insurance plan. The main idea behind step therapy is that many health conditions can be treated with different but equally effective medications. Since it's hard to know in advance which drug will work best for each person, insurers prefer starting with less expensive options. This approach helps control overall medication costs while still aiming to provide effective treatment. It benefits both the insurer and the patient by reducing unnecessary spending. However, step therapy can sometimes cause delays in getting the original medication your doctor prescribed. This might affect your treatment timeline or comfort. That's why medical organizations emphasize transparency in the criteria used for step therapy and advocate for quick appeals processes. If a patient is already stable on a medication, they should not be forced to switch. Exceptions are often allowed if there are valid clinical reasons. From a health insurance perspective, step therapy is a financial tool that fits into formulary management. Formularies are lists of medications categorized into tiers based on their cost and effectiveness. Step therapy protocols are part of utilization management strategies designed to balance cost savings with quality care. Insurers usually requiring proof that lower-tier medications have been tried and failed before approving coverage for higher-tier drugs. In summary, step therapy works by requiring patients to start with preferred, lower-cost medications. If those do not work or cause side effects, then higher-cost options are approved. It helps manage costs while maintaining access to necessary treatments, provided there are proper processes for exceptions and appeals. Always remember, it's important to work closely with your healthcare provider and insurance company to navigate this process effectively. And for any medical decision, consulting your healthcare professional is essential to ensure the best treatment plan tailored to your individual needs.